Initially, when I was very, very young, I wanted to be a veterinarian, but I'm very allergic to cats, so that kind of threw that out the window. And then I've always just enjoyed helping others. I really enjoy science and biology. So those were kind of always my strengths in school. So it wasn't really surprising that I went into medicine as I got older, and that was kind of the course that I took. I'm with the Neurological Institute in the Center for Neurological Restoration in the Headache and Facial Pain Department. So I mainly see people who have different types of headaches and facial pain. So our job is to find out exactly what type of headache they have so that we can give the proper treatment for them and help get them living a better life where they're functioning better. There's no cure for migraines, but our goal is to improve their quality of life. Most of the patients we do see back regularly, which I like, because that's what I liked about family medicine. I really like building relationships with my patients, getting to know them, know more about their families, and then seeing them time and time again. Some of our patients who are really struggling, we see them for Botox treatment, so that's every 3 months. So those patients I get to know really well, and I really look forward to seeing them. I'm a big fan of reading, always have been. I like to read probably fiction the most, but we'll read nonfiction as well. Interact with and do things with my family, although my children are growing up and one just went off to college and one is still in high school. I try and ride my bike. I can't run as well as I used to because my knees don't tolerate, but I enjoy riding my bike. My husband and I both enjoy playing tennis. If we can find time for it, we try and do that.